So welcome back to the NDS Showcase. This is where we share stories and updates and progress from various projects and work streams across NDS. And in today's item, we're going to hear from Johnny Waldheim on the work done, the learning really from the EACP project. EACP, if you don't know, stands for Essential Anticipatory Care Planning or Care Plans. And so I'll throw to Johnny now and invite you to share your screen. I assume you'll do that. So the floor is yours. Great, that's looking good.
Brilliant. Hello everyone, and thanks for the opportunity to present a slice of the amazing work we've done at NES Digital Service in 2020. My name is Jonathan Waldheim. I'm a product manager here at NDS, and today I'm going to talk to you about some of the work we've done around anticipatory care planning. To start, it's worth setting the scene a little bit. So what is anticipatory care planning? NHS Inform describes it as an opportunity for you as a citizen to make informed choices about how and where you want to be treated and supported in the future. It requires health and care practitioners to work with people and their carers to ensure the right thing is done at the right time by the right person to achieve the best outcome. Anticipatory care planning is a huge space to be working in. There are so many preferences and priorities that a person might have, and so many different situations in which they might start thinking about it. So in order to start somewhere, we decided that we would use an existing process and form, RESPECT. The RESPECT process creates personalised recommendations for a person's clinical care and treatment in a future emergency in which they're unable to make or express choices. It's supported by a form which has a set of fields which are agreed. This was a sensible place to start, and we developed an application which we started to pilot in Forth Valley at the beginning of March 2020. Of course, at the end of March, a new problem came along, COVID-19. As the pandemic started, colleagues at Healthcare Improvement Scotland put together a template for short-form ACP conversations. This tool was to be used to capture information about people in vulnerable groups and then to be uploaded into the existing system for sharing information with unscheduled care services, the key information summary, which you can see on the screen. At this point, it became clear that perhaps a digital version of the template might be useful. Of course, at NDS, we want to take a user-centered design approach to this kind of project. We expected to transform the form rather than just digitizing it. So, as the form started to be used to guide conversations, often on the telephone, sometimes on NHS Near Me, our service design team decided to explore the space a little more. It became clear that there were some people who, although trained in having difficult conversations, might be conducting this kind of consultation for the first time in a long time. This got us thinking, what if we gave these people some information to use before, during, and after the conversation? What if we changed the model slightly and nudged good quality conversations through our digital product? The current model for this kind of interaction looks a little bit like this. A clinician is educated on how to have difficult conversations. A certain passage of time happens until they encounter a person who would benefit from an anticipatory care plan. This person and the clinician sit down with family where appropriate and have a conversation, or multiple conversations depending on the situation. The information is then captured on a piece of paper and shared with the person, and then later on it's transcribed into an IT system to be shared with the rest of the health and care ecosystem. So why don't we help remind clinicians about how to have good conversations closer to the time a discussion is needed? And how might we do this? Could we slot some guidance and pair the conversation and data capture together? Remove the burden of typing up afterwards? This became our hypothesis. To start with, we highlighted our assumptions about ACP conversations. This allowed us to think about who we should talk to attack the work. Our service designers then put together a wireframe as a probe for user research conversations, which were organised with NHS staff. Starting with a visual to demonstrate our hypothesis was useful, as it gave people something to comment on and something to drive the conversation. The outcome of the discussions were really positive. People were really interested in the wireframe and the concept of having some guidance around an application. We decided that we needed to move the work into the next phase. Our user interface and interaction designer worked to turn the wireframes into something that could be implemented as part of the system. We took a content design approach, working with a select group of clinicians to create the content in the discussion guide. And of course, once we had done these, the only sensible thing to do was to show more designs to users. Once we'd received enough feedback from this second cycle, the development team then put the application together into a working application. This gave us our final opportunity to test this hypothesis, which we did with selected colleagues from NHS Lanarkshire. So what did we learn and why is this relevant? From this exercise, it was clear that there is truly an opportunity to make digital the default position for difficult conversations. All the tools we build should think about directly in clinical and patient experience. We should stop thinking about using the paper first, or at least we should try and find a way to bring digital into the conversation. So on that note, I'd like to bring you back to respect, which is where we started. As time progressed through the EACP project, and we went through these different cycles of design and testing, it became clear that the work on EACP could definitely be portable to our respect application. Shouldn't we be helping people with difficult conversations at all times, not just in a pandemic? And so that is what we have done. Respect version 3, which we're hoping to launch in Forth Valley in early 2021, will include a discussion guide embedded within the software. On that note, I'll bring my talk to an end, but I'll leave you with some important questions to reflect upon. Do you still write things on paper and transcribe them later? If so, why? Would you be willing to change this behavior, and would you be willing to co-design digitally an ACP with a person, letting them see your notes and input as you write them? Thank you.
Great, thank you, John. You just got a couple of questions from the chat, if that's okay. The question from Blythe as to how does Respect differ from EACP?
So Respect captures more detailed information about a person's preferences and priorities. It's also an application on the National Digital Platform. So this will enable the information to be shared between clinicians, people, care homes and unscheduled care. So the right data for the right people at the right time.
Cool, thanks, Johnny. And from Alistair, is EACP, where is it? Is it available for use currently?
Yeah, so we're still hoping to launch EACP as a lightweight tool for use in early 2021. We're working with our partners at Healthcare Improvement Scotland to make this happen, and we're looking to have a soft launch toward the end of this year and a fully communicated launch at the start of next year.
Cool, thank you, Johnny, for that. And again, great to hear the progress and look forward to hearing more in the new year. So that's all from the showcase on EACP, and we'll see you soon.